if you have any other questions. And without further ado, we're going to start. Okay, so today we wanted to talk a little bit about things not related to COVID. Everywhere around us, we're hearing about COVID and what we need to do and what we need to, precautions we need to take, but we need to kind of also remember that it's not all about COVID. So a recent study showed that up to 50% of people are postponing or canceling doctor's appointments or testing because they're afraid to go out into the medical hospitals and physicians' offices and such, just for fear of contracting COVID when they go out. Approximately 10% of them, however, also reported that some of their medical issues have become worse in that time. And this is important to note because, as all of us have heard, so I will not reiterate, there are certain chronic health conditions that can make us more predisposed, which means more at higher risk of having issues related to make our COVID-19 more extreme for some people. So people with high blood pressure, diabetes, things like that. So we won't dwell on that, but the focus of today is to talk about ways and things not to ignore so that those other issues we have that possibly we haven't really been paying attention to as much aren't ignored. So I wanted to start with a little story. As a nurse, I've been doing this a long time, and I recently heard a story from a fellow nurse who told me about a patient that woke up one morning just not feeling right. The patient had a history of high blood pressure and cholesterol, but it was well maintained, and just woke up not feeling all that well. And so the family member said, I really think maybe you should go get looked at because the person was having a little bit of chest tightness, and it was kind of intermittent, not always there. Over the course of the next few days, it lingered, wasn't great, wasn't better, wasn't worse. Unfortunately, on day 4, the person woke up and was having a full-blown heart attack and came into the hospital. And, the family member said to this nurse that I know, I wish that they would have just listened. They were so afraid to go into the hospital, they were going to get COVID or they were going to get sick and it was going to make things worse, that now they've unfortunately have a heart attack. So that was one of the motivators for me to want to participate in this, because I think that as we're all trying to navigate these new waters, it is alarming and it is nervous, but we still have to keep going about what we're doing. And we have to remember that we need to take care of all of our other health issues. So that is my public service announcement with regards to that. So now let's move on. Okay, so what are some of these things that we're talking about or I'm mentioning that we shouldn't ignore? Chest pressure, tightness, or pain. If anyone here has any kind of cardiac issues, they know pretty much what that feels like. But any kind of like someone sitting on your chest or a tightness or pain that's just in your chest, it can sometimes present a little bit like gastric pain. So if you have gastric issues, it can sometimes be like that as well. But it's important not to ignore it. Okay, if you have it and you're on medication for it and it's not going away, don't just think, well, it'll go away, so I'm just going to keep going about my day, because that might not happen. Shortness of breath or difficulty breathing. Yes, these are symptoms that definitely come possibly with COVID. However, if you are someone who has a history of asthma or COPD or exercise-induced asthma or allergies or things like that, and you find that you're having a more difficult time breathing on a regular basis, and what I mean by that is, typically you can walk to the car and get in the car and not get winded. And now all of a sudden you're finding you're getting winded. That is not something to ignore. Something that is out of your norm is what we would call something not to ignore. So those are some things that are related to heart attacks or cardiac conditions. I want to go over some things that are related to what to look for if it's possibly a stroke. So facial drooping. So some people, this is really, we're not going to know it unless we look in the mirror or we're talking to someone who says, what is wrong with your face? So facial drooping, though, would mean like part of your lip sags or point of your eyes is sagging or just doesn't look right. Okay. If you happen to look in the mirror or someone says to you, I think something might be a little bit off, that's absolutely a medical emergency that you want to get to an ER for right away. Arm weakness. As we all, not all, but I'll make a generalization and say that unfortunately as we age, arthritis is something that we absolutely do start to have more of as we get older. Osteoarthritis, different forms, if you have any other kind of rheumatoid arthritis and things like that. Arm weakness or just, age alone can cause some weakness. What we're talking about today is all of a sudden this left arm is just not doing what it did last night. That's a problem, okay? Along with difficulty speaking or saying words. If you can see the word, but for some reason it just won't come out, that's another reason that we want you to make sure that you get to be seen right away. New onset dizziness. This one can be caused by multiple reasons. And, if you're someone who occasionally gets vertigo or things like that, we're not talking about a vertigo episode. We're talking about you wake up and you're just dizzy. And for whatever reason, you just can't seem to get your wits about you. That's something to be concerned about. It could be related to your medication. It could be related to if you're a diabetic, if you have not had enough to eat. There could be a lot of different reasons, but the point is that we don't want to ignore it and we want to make sure that we seek medical attention right away. Allergic reactions. So allergic reactions, many of us at this point in our lives know what we're allergic to, but sometimes, the truth is ingredients in food change all the time. And so we want to make sure that we know what those are. So let's say you eat something that you've been eating for a long time, and all of a sudden you're just noticing some scratchiness in your throat, or your eyes are itchy, and, you're just thinking, this doesn't feel right. Okay. So it's important to immediately recognize that something is happening and not just brush it off, because what can happen with an allergic reaction that's unattended is that it can turn into an anaphylactic reaction, which can potentially turn into a more harmful issue. So, let's say that you ate this 2 days ago and you felt a little bit funny, but nothing really, and it went away. But now you're eating it 2 days later and, you're noticing your eyes are getting swollen and your throat just feels kind of scratchy. When you're allergic to something and you don't realize it, every time you're exposed to it, the reaction gets a little bit worse. So if you feel that something's not right or you just feel off, you know your body more than I could know, more than your doctor, your nurse practitioner, whoever your provider is, you definitely need to make note. Injuries to the head or eye. So injuries in general need medical attention. But if you have fallen, okay, and you're not sure if you banged your head, but possibly you did, or let's say you were doing something and you accidentally scratched your eye. Unfortunately, eye injuries can be okay. And then all of a sudden, you can get a detached retina and you can have just multiple issues that are a result of an eye injury. So if you have a head or eye injury, it's important to let the doctor know. And then they, give your doctor a call. Obviously, if it's a serious head injury or eye injury, you want to seek medical attention right away at the closest emergency room. I do not suggest you drive yourself if you have a head or eye injury. Get a neighbor, call 911. You want to make sure that you're not putting yourself or anyone else at risk if something like that would occur. A serious burn. Let's face it, we're all cooking or trying to get creative because we've now been, not really going out as much and being able to have food, fancy meals at restaurants and such. Some of us are, I'm sure, doing takeout, but a lot of us I know are cooking and trying to get creative with what we're cooking. So if accidentally you get a burn, or let's say you were out in the sun and you get a little bit more burn, a burn generally is like a first degree burn is something you can take care of. But if you notice that, you're taking care of it and a couple days later, it's still not looking any better, you want to seek medical attention. And the main reason for this is because burns that are left unattended can turn into infections. And if you are someone who has other medical issues, then those medical issues can get worse because of a burn that isn't being treated properly. So it's important to make sure that if you have a burn, we don't downplay it. I know a lot of us like to say, oh, I'm fine. You know what? I'm just going to put a bandage on it and I'm going to, it's going to be okay. We really, that's not something we want to ignore for sure. Okay. High fevers. Fevers, I know, are something that are an indicator of possibly COVID, but they're also an indicator of so many other things, the flu, an infection. It's important to note if you're not feeling well. If it's 80 degrees out, or we'll say, for instance, today, if it's, 70 and muggy, and all of a sudden you're freezing, it's important to kind of take note of that and not just dismiss it. I know, as with other issues, sometimes we're all like, oh, pish posh, I'll be fine. But it's important to make sure, because high fevers can definitely lead to more disease and infection and some other more serious medical issues. Wounds and cuts that are not healing. So as people get older, and even younger people alike, there are certain medical conditions such as diabetes, peripheral vascular disease, and other circulatory issues that can contribute to wounds and cuts not healing. It's important that if you're diabetic, it's important you do skin checks regularly. But if you notice that you got a bruise or a cut on your knee a few days ago when you were, walking through the living room or whatnot, you tripped or, stubbed it on the corner of the table, make sure that you keep an eye on that cut, because if it doesn't get proper attention, it cannot heal properly. Sometimes the wounds that we get, we think aren't as bad, but sometimes they're actually deeper. And so that's important that we keep an eye on them. took too much medication and possibly have an overdose. This is a pretty common reason that many people wind up in the ER. And the main reason that this happens is because, let's say you do have a lung issue, or you have a heart issue, and you're seeing a doctor appropriately, and you're following all the rules that the doctor is giving you, and you're taking the medication as to best as prescribed, but you also have a primary care provider. It's important to make sure that the primary care provider and the pulmonologist and any other specialist you have, that everybody's on the same page about your medications. And that's important because sometimes there can be a potential overdose, because let's say that the cardiologist puts us on one medication for your blood pressure or your heart issues, and then the primary care provider puts you on a different medication, but it does the same thing. Sometimes as patients, we're not as well-rounded as we like to think we are. Even as a nurse, I sometimes will get a medication and then look at it and realize that it's a different brand, but it does the same job. So it's important to be mindful of what we're taking and to talk to your provider so that we're not doing what we call double dosing. And we want to make sure that, we don't want you to wind up in the ER, something having some kind of overdose effect. Ingesting a poisonous substance. I think all of us are well aware of, being mindful of what we are eating and drinking. But in this day and age where everything is being harped to us to clean with cleaning products and, be mindful of bleaching things and cleaning our hands and hand sanitizers and things like that, it's important to note that after you clean and before you eat anything, wash your hands for at least 20 seconds with soap and water and make sure they get dried all the way, because it is possible that if you are using a cleaning product and it's very strong and potent, and then we don't clean our hands and you eat something, a little bit of residue might get on there. So you don't want to, you want to be mindful of that. And to that point, if it does happen, you want to make sure that you call poison control or get to the closest ER as soon as possible. New or increased swelling or in your legs and feet. If you're a person who has congestive heart failure, or a person who is, not used to, but has seen swelling occasionally, then you know what to look for. But let's say that all of a sudden you're starting to have increased swelling in your legs and feet, and that's not something you've had before. That can be signs of other medical problems, so you definitely don't want to ignore that either. So a couple tips while I'm wrapping up. You know your body best. Pay attention to how your body feels. It's important that, especially now when so many new things are popping up. I mean, I encourage everyone to limit their media attention, but every day we're hearing new things. Do this, do that, don't do this, don't do that. Go out, don't go out, wear a mask. It's important to listen and take a moment to decompress every day for a few minutes and just kind of check in with your body. It really is important. October has Mental Health Awareness Month, and it's important that we as individuals, that we listen to our bodies and that we do what is best for our body. Okay? Stay in touch with your medical provider. I know we talked about this in the beginning. Mimi is going to give us some great information about how to safely go back into our medical physician's office. Be sure to get your flu vaccine. That's important. Practice social distancing, hand washing, wearing a mask, like we talked about. Stay active as advised by your provider, eating a healthy diet, and don't ignore your body and what could potentially be a medical emergency. And very important, I found some information when I was doing research for this presentation that is saying that some patients are not wanting to go bother their doctor by going to see them, thinking that doctors are so inundated and medical professionals are so inundated taking care of COVID patients that they really don't have time for the regular not sick patients. It's not true. And it's really important that that you realize how much all medical professionals care about everyone in the community, not just the people with COVID, not just the people that are caring for the people with COVID. We want everyone to stay healthy. Okay, so I'm going to turn it over to Mimi now. Thank you, everyone. All right, Mimi, take it away.
Thank you, Nicole, and thank you, Ann and Deacon Jerry. And it's great to be back with all of you today. Welcome. This part of the presentation, I'm going to continue to talk about receiving healthcare during an ongoing pandemic, but I'm going to talk more specifically about how we can stay healthy with recommended screenings and immunizations. And then I'll talk about some best practices for receiving healthcare services during an ongoing pandemic, protecting ourselves and others, communicating with our doctor's office and advocacy, and then I'm going to wrap up with some resources. So when we talk about preventative vaccinations and screenings, it's important to know why these are important And the reason is that if we maintain these screenings, it will help us to be more healthy as we age. It will also help prevent some disabilities and diseases from occurring, or at least the progression of them, if we know what's going on. So studies are showing that during this COVID period, individuals are not getting their vaccinations, not just seniors, but across the board. And it's because of COVID. They're afraid to go out. They're afraid to go to the healthcare arena. So prior to this COVID pandemic, seniors were doing really well with vaccinations for pneumonia and for your flu vaccination. About 70% of seniors were getting those vaccinations. But some of the other preventative screenings and immunizations, only about half of seniors were participating in them. So I'd like to talk about all of them. And that being said, I want to go over the Centers for Disease Control recommendations for the screenings and the immunizations. So I'm going to touch on each of them. The first one's the obvious one we always think about, the influenza or the flu vaccine. Did you know, and I didn't know this until I researched it, 85% of deaths and 65% of hospitalizations are attributed to the flu in individuals over the age of 65. That's a stunning number. Another vaccine that's just as important is the pneumonia vaccine. So be sure that you're getting that. Also for women, breast cancer screening up until at least the age of 74 and beyond, if you have risk and as a safe practice. I read that a half of all new cases of cancer of the breast are in individuals over the age of 65. We hear a lot about colorectal cancer screening, and that's very important. And then, of course, diabetic screening, because let's see, about a quarter of individuals over the age of 60 have diabetes. So that's very important because as we age, that may develop. And another essential screening is cholesterol or lipid screening. That can detect your risk of heart attack or stroke. So that's very, very important. And mostly for women, osteoporosis screening to help prevent or foresee if there might be a fracture that might happen in the future if your bones are weak. So that's important too. Now, depending on your situation and working with your doctor, some individuals may need tobacco or alcohol screening and counseling. So that's an individual thing with your doctors that's recommended by the Centers of Disease Control. And there are some additional screenings and vaccinations that I want to talk about now, but keep in mind that some of these really depend on your physician. So you need to have that individual conversation with your physician. The first one is aspirin use. Some people take a baby aspirin every day. However, it might not be for everyone. So that's a conversation you have to have with your doctor. Blood pressure screening is for everyone. And 71% of seniors have high blood pressure. So that's something we have to keep a check on at least every year when we have an annual exam. For women, cervical cancer screening is usually done up until the age of 65, but you may want to discuss that with your physician too in case you have specific circumstances. Depression screening is essential because, especially for seniors, depression is often not diagnosed and not treated. And it may be a part of or confused with dementia. So that's very important. Obesity screening, and then also the shingles or the zoster vaccine. That's something that you want to talk to your doctor about as well. A couple more that I want to mention. The Tdap, if you've ever heard of that, that's the tetanus, diphtheria, and pertussis. There's a booster every 10 years. Your doctor may want you to receive that for a number of reasons, but two reasons. If you cut yourself, you're protected with the tetanus vaccine. In addition, pertussis is whooping cough. And if you have an underlying lung condition or you're a senior, you may be at more at risk of serious illness if you get whooping cough. Then I'm just going to mention a couple more. Try to keep your dental exams up to date. Eye is very important. Every year, seniors should have a dilated eye exam to check for glaucoma, macular degeneration, and any other changes in the eye. And that's because these conditions occur more frequently as we age. So that's key. Hearing screening to see if we need hearing aids, because we don't want to wait too long to get them if we can get them early on and get used to them if we need them. Foot screening, going to a podiatrist, especially for diabetics. And then, of course, dermatological screenings for cancer, melanoma. And then just another thing about screenings briefly, flu and pneumonia are almost always covered by all insurances. But then the other screenings and vaccinations, you really need to check with your insurance company and with your doctor about them, if they're necessary and what the cost is. And if you need help navigating that, please feel free to reach out to us in Vitality. We would be happy to help you there. So as I continue with the presentation, that was all not about COVID. But now as we talk about best practices in receiving health care during COVID, it's more about COVID. So sorry about that, but these are important tips for us to keep in mind. Studies are showing that individuals are having a lack of trust and confidence in the healthcare system, and they have some confusion about the delivery of system with COVID. It's understandable because things have just changed so dramatically. So as the pandemic continues, healthcare systems must balance the need to provide the necessary services while minimizing the risk to patients and healthcare personnel. They really want to keep us all safe. And remember that healthcare providers have been given specific guidelines by the Centers for Disease Control to keep us all safe so that we can have our screenings, we can have our doctor's appointments, we can stay in check with our health during this pandemic. So when it comes to best practices, according to the Centers for Disease Control, I'm just going to mention some of them. If you've gone to a doctor's office, you know about the screenings over the telephone. They're asking, how are you? Do you have a fever? Have you been out of the country? Now they're asking, have you been out of the state? What state have you been to? And they ask a lot of questions. And yesterday, Ann and I were at one of the parishes talking, and somebody said, you feel like you're being cross-examined, but it's for your protection and it's for other people's protection. So answer them honestly, because they want to be sure that you're safe, they're safe, but then they can also use that to triage you to a televisit if there's any chance that you might be sick or contagious. They could triage you and do a televisit for you. So another best practice is offices telling patients to stay in the car and call in when they arrive for their appointment. Has that happened to anybody? So you may have experienced that, yes. Now yesterday, unfortunately, we had a senior tell us that she waited in her car 2 hours, and that is just out of control. So I'm not sure what happened, but something went really wrong with that. And we'll talk a little bit later about advocacy too and communication. The other thing that the Centers for Disease Control are saying that screening should take place in, pardon me, at all entrances to facilities and at the doctor's offices. So not too long ago, I took a family member to a multi-specialty complex for physicians. And we went in the door and we went right to the receptionist, and she took our temperatures. She asked us the screening questions again, okay? So they're following these recommendations. Another thing that the Centers for Disease Control are requesting providers to do is visually post notices at the entrances to facilities. Have you seen them? Pictures of masks, washing your hands, social distancing. The problem is when they get too many things posted up there, and I've seen it. just a lot of stuff. So, maybe it's happened to you. It's happened to me. I left my car yesterday. I forgot my mask. And I'm like, so that's a reminder to you. Don't go in the building without your mask. They have a picture there. They're reminding you to do that. And then some offices and hospitals are setting up separate waiting rooms for individuals that may be sick and contagious. And that's to help us all. Some other recommendations. I want you to know that the Centers for Disease Control have given providers specific infection control measures for cleaning and disinfecting. You may even see it while you're in the doctor's offices. I've seen them cleaning and taking care of things immediately. They've requested that providers have hand sanitizer stations and no-touch trash receptacles throughout the area. Now, if you notice, even when you're shopping, wherever you go, you're going to see hand sanitizer stations just about everywhere. And I'm going to suggest that you take advantage of them because not everybody does. And then let's talk about visitor policies. Some centers and providers restrict visitors completely, and others may limit visitors. So we're going to talk about that under advocacy in a minute. And some doctors are using more telehealth, and then mental health providers are using a lot of telehealth, phone calls and Zoom meetings with their patients and clients. And I want to also mention this, for individuals who are more homebound, some physicians are utilizing visiting nurses and home care services more readily so that the nurse in the home, the registered nurse, can be the eyes and the ears of the physician and take back pertinent clinical information to him about the patient. So as our healthcare providers try diligently to protect us, I'm just going to review how we're supposed to protect ourselves at home, wherever we are, when we're in the doctor's offices. And Nicole touched on some of these, but I'm going to tell you again, and I'm going to mention two things that I see too much of, 2 or 3 things. So it's the same old thing. Wash your hands, social distance, wear a mask, okay? But wear a mask correctly. I see it all the time. It's hanging off, it's under the nose. Be sure it's covering your nose, your mouth, and your chin. That's the correct way to wear a mask. Also, if you're wearing a shield, recommendations are that you wear a mask under the shield for the best protection. The other thing I want to mention is when we're out and about, we're always touching things, no matter where you go. If you're at the doctor's office, doesn't matter, you're at church, wherever you are, take advantage of those hand sanitizers. I don't see them used enough. I see people walking past them, and it's very important to utilize them. You don't need a whole lot. Just put it on, go between your fingers, get your whole hands, and you're supposed to really rub until it's dry. That's the most effective way to do it. And then another tip about getting to the doctor's offices and to healthcare providers is seek out the safest method of transportation. So if you have a friend, a family member to take you, that would be great. Okay. And, I don't know if you heard on the news yesterday, but I heard that if you're taking Uber or Lyft, they're now mandated to wear a mask. Although I think probably they've been wearing masks if they want customers. But if you do use those driver services, they are mandated now. So there are many things in place to help protect us. And yesterday, I also heard that if you crack your window just 3 or 4 inches in the car when you're with someone, that's enough to help circulate the air and to decrease the amount of possible contaminants in the air. So keep that in mind when you are with other people in a vehicle. And if you are in county transportation or other type of transportation, just look around you, try to carry some hand sanitizer with you if you can, wear your mask and social distance. So as I wrap up in a few minutes, I just want to mention a few things about communication and advocacy, because this has been a very difficult change for our healthcare providers and for us. And they're striving for effective communication with us, but it's not always working out. And Nicole referenced that a little bit earlier. Getting through the doctor's offices, I've noticed it, my family's noticed it, has been more difficult. You may have to leave a message. You may have to leave a couple of messages. You may need to call back. So my advice to you is to be persistent. Be sure that you continue to work with your health care provider to get your medical needs met as quickly as possible. Don't just forget it and say, it's not that important. It can wait, because it probably can't wait if you're trying to reach them. So be persistent, seek out an advocate. Okay, if you need help from a family member or a friend, or if we can help you in any way to interface with your care provider, we're happy to do that, one of our nurses or social workers. Because it can be very difficult, and they have restrictions on bringing a visitor with you to an appointment. But I will give you this advice. If the patient needs someone to accompany them, you need to tell them that. I have several family members who sometimes get upset at the doctor's office, don't hear what's going on. They don't hear the information, and they don't always know what to do at the end of the appointment, what the next steps are. And we know that the paperwork the doctors give you don't always outline everything. If you're supposed to go for a test, and how do you get it, and where do you go, and what do you do? And sometimes they forget to give you information. So keep that in mind and make it clear to the provider that you need somebody to accompany you if it pertains to you or someone you know or you love. And then last but not least, I just want to mention resources. As you know, we're here for you at Vitality to help you navigate through this complex healthcare system. With everything going on right now, you can certainly call us. Anne, there you are, Anne. Anne will be giving you the phone number afterwards, I think in a follow-up email. And just so that you know, there is help out there for you, someone you know or you love. We can help connect you with programs and services to help you get help in your home if you need that. Help with insurance, maybe counseling, support groups, friendly visitors or friendly callers, Stephen Ministry, parish nursing, help with your medications, and so forth. So there are many areas that we can assist you with, and all you have to do is call. So I thank you for your attention, and I hope you have a great rest of your day.
Thank you both Mimi and Nicole for a great presentation. We can take away with us many health tips to manage our current health situations during this challenging time. Does anyone have any questions to share at this time, or any thoughts they would like to share? If so, you can simply wave your hand. You can use the electronic hand at the bottom, or the chat option, both located at the bottom of your screen. Both features are listed at the bottom of your screen, or just wave your hand. And then you could just take yourself off.
All right, hold on 1 second. Okay, Deacon Leo, I think, right? I just unmuted
Yes,
you. You had your hand up first.
Yeah.
Go ahead.
Okay.
Okay, I have a kind of a general question. I got a letter from one of my doctors, a neurologist, that their office is closing and the practice is being discontinued. And so I guess my question is, do you have recommendations regarding how to find a new doctor?
Mimi, you want to take this one, or you want me to take it? You have to unmute.
It does. I mean, I already started, but I was muted. Either way.
Oh, sorry.
It doesn't matter.
God, sorry, I didn't realize you were on mute. So my thoughts would be to talk to if you've been notified, call them. Call the neurologist and see if they recommend anyone, because sometimes doctors will speak to other specialists so that they can, see if other physicians are willing to take on some of their clients. And then also you can request your medical records so that you have them. to take to your next doctor, but I would probably start with the current neurologist and see if they have any recommendations. Mimi, what are your thoughts?
Oh, I definitely agree with that. They may have some doctors in mind for you. It was for, I think you said urology for follow-up. Okay, but also another way to approach it is to take a look at what hospitals you like, what hospital systems, who they have in those systems, possibly your insurance, if you have a network or not. And you can always call us and we can help guide you in that area as well.
Thank you.
Good luck.
Can I just add to that? Let me just add to that a minute for Leo too. Leo, when a practice closes, they're legally obligated to provide you other names of physicians who would be able to take their place. So seek that out from them, obviously, and get that list from them. And then, as I think Mimi just said, the best reference is cross-reference that to your network of insurance to make sure that those doctors that they are obligated to give you are also in the network of care that your insurance covers.
Okay,
Thank you.
thank you. Anyone else have any questions? Frank, you want to take yourself off mute and you can ask a question?
Go ahead, Frank, you can go ahead.
Okay, I got it.
Hi,
I
Frank.
was looking in the paper here, and it says our latest transition rate is 1.13. Now, what's that saying is that everybody who's infected, I guess, infects another person. I think that's what it read over here. And I'm saying, like, with all these new cases that they're finding, and they keep on saying the case count is going up and up and up, how come the hospital counts are not coinciding with that if this spreads so fast? And that, I mean, I don't see in the statistics, they don't seem to be bearing out.
Mimi, you want, I mean, I have a comment, but maybe you can take it if you want.
Well, the first thing I was going to say that came to my mind is that there's more testing. So more cases are showing up and that the cases may be milder cases. Nicole, you want to add to that?
I would echo what what Mimi said, excuse me. And I would also say that, Frank, there has been an uptick in hospitalizations. It's just not nearly as high as it was in the beginning of the pandemic. And some of that is that we've learned a lot in the medical community. They've learned a little bit about how to do prevention and how to, what to possibly treat first, et cetera. So we have more awareness, I'll say. So yes, that is what that means by the transmission rate. It means one person is potentially infecting 1.3 people. But, I think like Mimi said, it's just we have more testing available. Deacon Jerry?
Yeah, just to add, the other statistic on that, Frank, is that the highest group that's seeing the big uptick is from 20 to 50 years old. So what we're finding too is a younger demographic of people are getting this through the transmission of how they're gathering or whatever else is going on. And obviously what happens is the younger one is the immune system may be stronger, and this disease doesn't present itself as drastically as it would, say, in someone who's 60 plus, who may have other compromises to their chronic health conditions, whatever. So I think we're seeing a lot of reasons, the testing going up, younger people getting it, less mild symptoms, they're having milder symptoms that don't require. But as Nicole says also, and I've noticed locally, our hospital beds are getting more filled with more patients who have COVID, but they're being discharged. They're not necessarily going on ventilators or in the intensive care units as much. So the treatments have gotten better and the disease is a little more under control, but yet it's spreading because of the nature of how it spreads very easily.
Do they feel that the strain is getting weaker now with the disease? Is that why a lot of people?
No,
Because
I don't think it's, I don't think it may necessarily be that. I think the people it's affected are stronger because we're controlling it better. And I think that when you look at, like, for example, in college campuses, when they had to close them down because of the spread, these are all younger 20-ish type people, healthy, and just wound up having minor symptoms. Some no symptoms at all, but yet they had tested positive for the disease. So I don't think the strain itself may be any different, but the host of people it's affecting are stronger, and the therapeutics have gotten better. The treatment options are much better now, and we kind of know how to manage it in the hospitals a lot better.
What kind of therapeutic options now does the governor of New Jersey have under restriction that we can't take?
I don't know of any under restriction
Don't know any.
because
Yeah, that's
Restricted.
not, yeah, that's
We could
not,
take that
yeah, that's not something I think
hydrochloride.
we're,
Is that allowed in our state?
it's up to your doctor. It's up to your doctor. And all these drugs may not be approved by the FDA, but they have what's called sort of emergency use or compassionate use, we call it, where if someone may benefit from it, they're allowed to give it.
Okay.
Yeah.
yeah, but that's up
Your
to your
doctor.
provider. That's not, yeah, that's not something that we're going to, because truthfully, the information comes in differently and it, you know, it's ever
Right.
evolving.
All right, okay.
Okay. Does anyone else have any other questions?
Okay. Then I would like to remind you about our next webinar scheduled for November 18th at 11 a.m. It's going to be titled Hopeful and Healthy Holidays. We will focus this presentation on the COVID-19 pandemic and the effect it may take on our Thanksgiving and Christmas celebrations this year. This afternoon, I will follow up with an email to you with the vitality resources that Mimi shared. If you or any loved ones have any questions or concerns or need any assistance or support, please feel free to reach out to us. Mary Jane, I see you waving your hand over there. Do you have a question for us?
No, I just have a statement that
Okay.
I very much appreciated the presentation. And I think one thing that we can all do, and it's underrated all the time, is hydration. And, you know, drinking water is one of the most important things we can do. And it's easy to do. The only drawback to that is if somebody has history of heart failure.
Right.
And then they have to be careful. But as I age, I can definitely feel the effects when I don't drink enough during the day as I'm just running around doing everything.
Thank you for that tip, Mary Jane. Yes,
you.
hydration is very important.
It is. And it's also, like you said, important to make sure that you're not overhydrating if you do have any medical problems that need attention, such as heart failure and things like that.
Correct.
Thank you for bringing that to our
Yes,
attention.
thank you, Mary Jane.
Mhm.
Okay, anybody else? If not, I'm going to hand it over
Yeah, I
to
got-
our, oh, yeah, Frank.
I got another one. What could we do to build up our immune systems besides eating good?
Amy, Nicole.
Getting plenty of rest, making sure that you're sanitizing and washing your hands appropriately, but not over sanitizing, because if we over sanitize, which I would mean, you know, if you touch something, as Mimi said, we all touch a lot of things during the day and sometimes we don't realize it. But if you're constantly using hand sanitizer and you're not really touching things in between that would contaminate your hands, that can be so. But good rest and staying healthy overall. So like we talked about earlier, managing your chronic conditions. Those are other things you can do to build your immunity, because the better your other chronic conditions are managed, then the better your overall health is, which leads to greater immunity.
Right. Do you feel
And
the gyms
Frank-
are safe now to go into? So that we could do exercise?
What, Frank, the gyms,
The
did you say?
gyms, yeah, like
Local
Planet
gyms.
Fitness and that,
Yeah.
right, yeah.
Yeah, Frank, I'll tell you what, a lot of the issues we're finding out now are coming through the more enhanced contact tracing systems that we have. And I'll tell you what, the gyms have been found to have no transmission rate, basically. So they're doing a good job because they were under a lot of scrutiny, and the safety measures are very extreme, as it is in many restaurants, even that the transmission rates are low. Where the transmission rates are highest, you know where they're the highest right now? In our own homes. When people are getting together, families and so forth get together for different events, you let your guard down and you wind up finding that you're in contact with people who may have been out of your, we call it your bubble, so to speak, and may have been exposed. And we're seeing a lot of transmission in our own homes more than anything else.
So true.
So that's where we have to be careful.
Right. Yeah. But
And I would add also, when you said about your immune system, Frank, if you're interested, I mean, I'm a believer in a lot of holistic methods and even multiple vitamins. You might want to look at a few, vitamin D and C and various things, because our diets are not always that great. And we we cook the heck out of food to the point that we lose its nutritional value many times, or it's processed and we don't get all the vitamins. So if you want to, do some research on, just Google, immune system and vitamins. And if you aren't getting them in your diet, sometimes some multivitamins help too, to just keep your immune system.
Yeah,
And I can't
saw
stress
my
enough the need for sleep. Take
Yeah.
the time to sleep.
Yes, sleep.
I saw my doctor recently and she gave me a test that I was low on vitamin D. So now
Yep.
she gave me supplements.
Good,
Mhm.
And
good.
I asked her too, that I said, one of the things I've seen to combat this is like zinc. So they always have that stuff when you fly on an airplane where, you take it a couple of days before with the zinc in it. And I
Mhm.
asked her if you just take that once a week, what would that do? And she said they haven't found no study between zinc and the virus doing anything. I don't know what you think about that.
So Frank, first I would encourage you, like Deacon Jerry said, to do supplements, but just make sure you check with your provider, because if you're on certain medications, you can't take certain supplements. So that's actually really important to note as well. The zinc, I would say that as everything else, it's evolving. There has been some literature, but I don't believe that there's any significant studies out there correlating zinc to a max potential benefit when it comes to COVID. So again, I would just defer to what your provider is advising with that.
Right. Okay. But what does zinc builds your immune system too, right? What's the
It
primary
does have a
purpose?
connection to immunity. Yes. Yes. And
Right,
for
okay.
yes, that's where the connection is.
Right.
Okay, wonderful. Well, thank you all so very much. I truly appreciate you all joining us today. It's wonderful to see everyone. I look forward to seeing you again in November. And Deacon Jerry, do you have any closing comments? And you'll give us a special blessing also. Thank you.
Well, first of all, I want to thank our staff, for Mimi, Nicole, and Ann, for your work on this. And thank you for all being with us today. I hope you all found this to be very helpful and informative, and can try to at least help get you through some of the issues you may be dealing with now. And we certainly appreciate your association with us here at Vitality. We're here to help you, so anything you need, please feel free to always be in touch with us. I know we have a lot of concerns these days for our health with everything that's going on, but I hope that the message was very clear for everybody today, and that is to truly be attentive to your health issues that you have currently. Don't put things off, don't delay care. The doctor's offices, the hospitals are very safe places to be. They're taking the utmost care to be sure that there's no transmission of disease when you're there. The doctors want to see you. I think we have to get past the concept that when we started this whole pandemic, we said, just stay home, and if you get bad, then come to the hospital. And that was really bad medicine. If you first feel symptoms and signs of problems, that's the time to get in and see your doctor or call your doctor, and take advantage of telehealth. Many doctors' offices will do just as we're doing now. They'll talk to you on the screen, and they can really help you quite a bit to solve some of the problems and maybe prescribe things for you that you would need, where you would even not have to worry about getting into the office. So that's a big push today that has happened as a result of the pandemic. And I think it's going to be the trend to come. I think we're going to see more and more of this going into the future. So take advantage of that if you can. So again, I thank you all for being with us today. So if we could maybe quiet ourselves for a moment and pray to our Father. In the name of the Father, Son, and Holy Spirit, amen. Heavenly Father, the God of all creation, we thank you for our time together this morning. We praise you for your wonderful works in all of us. We ask for your continued healing upon all who suffer and those who place their trust in you. We ask that you answer our prayers always according to our needs and according to your will. May your healing grace come upon those who are infected with COVID. May your hand gently guide those charged with battling and defeating this disease. And may the Lord bless us and protect us. May he shine his face upon us, and may he be gracious to us and grant us his peace. In the name of the Father, Son, and Holy Spirit, amen.
Amen.
Hey, God bless you all.
Thank you,
Thank you.
everyone.
Thank you, Deacon. Thank you,
Take
everyone.
care. Be well.
Thank you.
Bye-bye.
Bye-bye.